Good morning and welcome to the 12th meeting of the COVID-19 Committee. We have apologies this morning from Monica Lennon, Annabel Ewing and Willie Coffey. And I would like to welcome committee substitutes Alec Rowley, James Dornan and Colin Beattie. And we're also joined this morning by Graham Simpson. I'd now like to invite each of our committee substitutes in turn to declare any relevant interests. And I'll start with Alec Rowley, please.
Thank you, Convener. I would refer to my members' interests within my register of members' interests.
Thank you. And now James Dornan, please.
No relevant interest to declare.
Thank you. And then Colin Beattie, please.
I have no additional interest to declare other than those already in the Parliament Declaration of Interests.
Thank you. Okay, we are joined today for our first evidence session by Jean Freeman, Cabinet Secretary for Health and Sport, who is to give evidence on the Social Care Staff Support Fund Coronavirus Scotland Regulations 2020 and the Care Homes Emergency Intervention Orders Coronavirus Scotland Regulations 2020. We've had a number of submissions on both regulations, which have been included in the papers for this meeting. Can I welcome the Cabinet Secretary to the meeting, along with her officials from the Scottish Government, David Williams, Director of Delivery, Health and Social Care Integration, Lorna Ashcroft, Programme Lead for Reform of Adult Social Care, Carolyn McGill, Solicitor, and Claire Meeko, Solicitor. So welcome to you all. And can I start by inviting the Cabinet Secretary to make a short opening statement?
Thank you very much, Convener, and good morning to you and to members. This is my first appearance before this committee. So I'm grateful for the opportunity to be here. I'll be very brief because I am sure there are a number of questions that members will want to put to me and my colleagues. The Coronavirus No. 2 Scotland Act is an important part of our response to the coronavirus pandemic. As you know, it provides us with new powers in our collective work to control the spread of the virus and minimise its impact on people's lives. Of necessity, it was put through our Parliament rapidly. We have since made new regulations to support or implement the various powers contained in the emergency legislation on social care workers and on care homes. For care homes, the overall purpose of the emergency measures is to ensure the swiftest possible intervention if the life or health of care home residents are being put at serious risk due to the coronavirus pandemic. The measures are intended to provide assurance to those who depend on these services, their families and the staff who deliver care, that additional oversight and support is available in the exceptional circumstances where it may be required. Following a period of consultation, we've brought forward the Care Homes Emergency Intervention Orders to supplement the emergency intervention provisions of the Coronavirus No. 2 Act, to ensure that Scottish ministers are in a position to exercise those powers. The regulations make clear that where a nominated officer is an officer of the local authority or a health board, that they are acting on behalf of the local authority or health board respectively, provide the nominated officer with the power to delegate actions and tasks to others, allow Scottish ministers to obtain information from relevant bodies where this information is required to consider exercising these powers, provides a power to the nominated officer and Scottish ministers to recover costs from the provider where appropriate, and makes clear that no claim for damages can be made against the Scottish ministers due to their exercise or failure to exercise their functions under the Section 65A of the 2010 Act. With respect to Social Care Staff Support Fund, as the committee knows, the Parliament also accepted an important non-government amendment to implement a Social Care Staff Support Fund, which we supported, and for the record, I am grateful to Ms Lennon for her work on that. Whilst the Scottish Government is not an employer of care staff, we are committed to fair work and are clear that social care workers should not face financial hardship because their employment terms and conditions do not meet fair work principles. The Social Care Staff Support Fund Coronavirus Scotland Regulations 2020 make provision to establish, administer and maintain the fund. We have worked closely with employers, trade unions and COSLA to develop the fund's criteria and administration. The fund provides support to staff who might otherwise face financial hardship when their social care work has been restricted and their income has been reduced due to having coronavirus or self-isolating in accordance with public health guidance. It also supports infection prevention and control in care home settings and care in the community. The fund became operational on the 24th of June, backdated to the 23rd of March, where eligible workers are still suffering financial hardship on or after the date when the emergency legislation came into force. Employers should pay staff their expected income when they are off work, sick or self-isolating due to coronavirus, and the employer then seeks reimbursement from the fund. Reimbursement to employers is made through the local mobilisation plans that are in place with integration or local authorities. Supporting guidance, setting out the process and eligibility criteria has been circulated to employers and is published on the gov.scot website. The committee will also be aware that whilst not part of these regulations, we have also established a death in service benefit that pays £60,000 to a nominated beneficiary where a social care worker dies in service due to coronavirus, regardless of what other pension or other arrangements may be in place. This became operational on the 10th of July. Convener, the measures I've set out reflect the combined efforts of all parties in our shared goal of ensuring that we're doing all that we can and all that's in our power to protect care home residents, their families and social care staff. Even so, as we continue to learn more about this virus and how it behaves and operates, I'm sure that there will be more that we will understand that we can do, and we remain open to that and committed to working with you and colleagues to consider how we can make further improvements. I thank you very much for this opportunity and look forward to your questions.
Thank you, Cabinet Secretary, for that introduction. And we have members wish to ask both about the support fund and also around care home regulations. And I know you have officials with you if you wish to bring an official in at any point to help in answering a question. If you can just name them, and that will give broadcasting an opportunity to switch on their microphone at the appropriate point. Can I start by asking a couple of questions around the care home regulations? These are regulations which grant Scottish ministers the power to authorise a nominated officer to take steps in relation to a care home where they are satisfied it is essential to do so for a reason relating to coronavirus, prevent an imminent and serious risk to the life or health of persons in that care home. Now, we've had representation from Scottish Care, who, as you know, are the umbrella body representing care home providers, who say that they are not convinced there is sufficient rationale and evidence for the introduction of these regulations. And they highlight that Scottish ministers already have the powers to enter into acquisition agreements for services where required. And their concern is that this legislation risks being counterproductive, causing alarm and distress for individuals and families in relation to the provision of their care and what may already be a time of significant challenge. So can I ask, what is your response to this? And can you tell us if these powers have been used thus far?
Thank you very much, Convener. To answer your last point first, no, the powers have not been used up to this point. These are exceptional powers, and they are there to allow us to act very swiftly. As you know from the regulations, Scottish ministers can act in advance of court agreement, but does need to secure the agreement of a court within 24 hours of acting, or go to court and then act. I understand to a degree the concerns that are expressed by Scottish Care, but actually I disagree that this provides additional anxiety or upset to families and residents, or indeed to staff. I think it provides an additional assurance to those individuals that in those exceptional circumstances where we are talking about life and limb, then Scottish ministers can act swiftly in order to ensure the protection of residents in any particular care home in those circumstances. And of course, as I've said a couple of times already, these are exceptional powers that would only be justified to be used in exceptional circumstances.
Okay, thank you. Thank you for that response, Cabinet Secretary. You may well have seen this morning that the BBC are reporting some investigative work they've carried out, which shows that in the period between the 3rd of April and the 17th of March, there were 179 red and amber notifications issued by the Care Inspectorate in relation to staffing shortages in care homes. There were 30 red warnings saying there were insufficient staff to properly meet residents' needs, and 149 amber alerts. And this was at a period, of course, when a lot of these homes were under pressure to receive patients being discharged from the NHS, who we now know were coming into care homes without being tested for COVID-19. So, I mean, this has obviously caused a great deal of concern in the sector and concern for both the care home residents and for their families. So I wonder what your reaction to that is, and I wonder if, in terms of what's being announced today, there's anything that can help the situation in the future.
Well, I'd make a couple of points, if I may, Convener. The first is that I have not seen those reports. More importantly, I've not seen the evidence that backs those. I've seen briefly the news coverage this morning, but no more detail. And so on that basis, I can't really comment any further on the work that the BBC has undertaken, although I'm sure that we will come back to that on future occasions. I don't accept that care homes were under pressure to accept people coming out of hospital during that period. Care homes and hospitals have always had an obligation to undertake a clinical assessment of both the individual's readiness to be discharged. In other words, there is no more hospital treatment that is required. So staying in that hospital setting, I think we've had these debates and discussions many times in the Parliament. We all understand that staying in hospital longer than your clinical needs require you to be there is not the ideal place for anyone, but in particular for elderly citizens. But clinical assessment in terms of readiness to be discharged, but also clinical assessment in terms of the appropriateness of where you would be discharged to. And it is in the care home's interest to ensure that they are ready to receive that individual and they have all appropriate measures and steps in place, including arrangements for any ongoing medical care that the person might need. So I'm reluctant, in fact, I don't accept that care homes were under pressure to accept anyone. Of course, matters have changed since then and we have learned as we go. The other point I would make is that where there are flags in terms of staff shortages, of course, during this period, I don't have the exact dates to hand, but over at least part of this period, we did have that portal available with a significant number of experienced social care staff that we were making available to care home providers to use if their rotas were either in jeopardy or a little unstable, or because they needed to have additional staff in order to implement the guidance that we had issued on additional infection prevention and control measures that they should be putting in place. Now, in the absence of the detailed information, it's not possible for me at this point to check whether during that there was a particular demand made in terms of the availability of that group of volunteer returners, but that's certainly something that I would want to look at.
Okay, thank you, Cabinet Secretary. I appreciate this news has just come out this morning, but I'm sure it's something that either ourselves or the Health and Sport Committee will want to probe it into further in future. We will now move on, and I'll bring in Stuart Stevenson, please.
Thank you, Convener, and let me just start by declaring that I have a close family members work sector. I want to just ask a single question, and it is about how the government will measure the effectiveness of the support they're giving to social care staff under the regulations, and what reporting will be published about the conclusions as to the effectiveness of that support.
Thank you very much, Mr. Stevenson. It is an important question. The way in which the fund is operating at the moment is in effect in a real-time basis, where with COSLA and the unions and the employers, my officials engage directly with them on a regular basis to look at whether or not there are any particular administrative arrangements that need to be improved, additional information that needs to be given to employers so that they can ensure they're accessing the fund, as well as making sure that employees know of its availability. GMB is undertaking a survey of its members. You'll recall Unison and GMB were particularly strong champions of an aspect of the argument for the fund in terms of their members' reluctance to be tested in case they tested positive and were then required to self-isolate, quite rightly, but their weekly income would reduce significantly. I am happy that we are gathering, of course, data as we go. We're very focused right now on making sure that the fund is available, it is being used, and that all proper administrative processes are as simple and straightforward and speedy as we can possibly make them. As we gather that data, I'm very happy to look at how we might publish demand on the fund, and also how we have addressed any particular problems in its delivery that have been raised with us, and the speed with which we've been able to address those. Further evaluation as to the impact of the fund hasn't been considered at this point, but again, I'm happy that we have a consideration of that in due course. Right now, our focus is on making sure that the money that is there gets to those who need it.
Okay, thank you, Stuart. Unless you have a follow-up, Stuart, we will move on to Beatrice Wishart next, and after Beatrice, it will be Adam Tompkins.
Thank you, Convener. Good morning, colleagues, and good morning, Cabinet Secretary and officials. As has already been alluded to, the Social Care Staff Support Fund should ensure that relevant workers don't experience financial hardship because of being ill with the virus, but that won't address the financial hardship being experienced across social care staff in Scotland. The pandemic's already exposed the vulnerability of social care, the social care sector overall, with staff being on low wages, some on precarious contracts with or without the virus. My colleague Willie Rennie's already asked before about whether a review of paying conditions for all social care staff would be undertaken in light of this. First Minister said that this was being considered, so can the Cabinet Secretary provide an update on that?
Thank you very much. It is a very important area, and I would share your view that the pandemic has highlighted a number of issues in the provision of adult social care, some of which we had begun to work on as a government in advance of the pandemic, and necessarily has been paused to some degree. That's important work that was undertaken because it directly involved those on the receiving end, if you like, of adult social care and their views. I would be very keen that we pick that up in what I think should be a wider review. I've said this on the record, I believe, in the Chamber, that I think we need to have, as a country, a wider review of adult social care, how it is organised, delivered, funded, regulated, in order to ensure that we address some of the issues that are not new, but have been thrown into sharp relief by the experience of this pandemic. We're working currently inside government to look at what might be the scope and range of that, and I would hope that we'd be able to update Parliament in the near future.
Thank you for that answer. Can I ask about data on care homes now? The regulations look to establish this exceptional power and to take control of care homes where necessary. And given the current balance between privately and publicly run homes in Scotland, I'm interested in the monitoring that the Scottish Government currently undertakes, which would lead to a decision like this being taken. Can the Cabinet Secretary confirm whether the Scottish Government holds and monitors data on the number of people who are resident in care homes in Scotland and the number of virus-related deaths in care homes?
Yes, we do. We know the numbers of care homes across Scotland and the mix of those between private local authority and third or independent sector providers. We also, through the Care Inspectorate, of course, have information in terms of their unannounced inspections and their announced inspections, and National Registers of Scotland publish on a weekly basis the information that splits the number of deaths in Scotland in terms of location, and that obviously includes care homes. We also have information through the additional work that we have put in place with our Directors of Public Health leading this on the number of care homes that have an active case at any point in time. And of course, the absence of an active case of the virus for 28 days is one of the criteria that has permitted some care homes to open up visiting in the next phase of our return to full visiting plan.
Thank you. It's been reported that the Care Inspectorate and the Scottish Government refused to share the number of virus-related deaths in care homes. That's been reported to them. The BBC report says, and I quote, "The government said data needed to be accurate and published in a way that protected people's right to confidentiality." Can the Cabinet Secretary elaborate on why the information will not be made public?
So the information on the number of COVID-related deaths, either where COVID is the cause of death or where it is a factor in the death certificate, is reported by the National Registers of Scotland, and it is reported on a weekly basis. And that reporting is based on death certificates. So that is very robust data, clinically signed off, and it is published on a weekly basis. The data that the care home, the Care Inspectorate receives is data from the individual care home, which may or may not have a clinical underpinning to it. So that is not robust data. That is data where a care home says to the Care Inspectorate, for example, two of our residents died this week. We believe that COVID was a factor in their death. That is not a clinical judgment. That is, it doesn't mean it's wrong, but it is not a robust judgment. So the data that we publish, and we publish a very great deal of data as the Scottish Government, has to be data that is statistically sound and robust and can be evidenced. And that is why, in particular in this instance, it is the NRS data that is the most reliable and, as I said, is published every week.
Thank you.
Thank you, Beatrice. And now move on to Adam Tompkins, please, and after Mr. Tompkins, it will be Shona Robson.
Thank you, Convener. Good morning, everyone. Good morning, Cabinet Secretary. I want to ask two questions, if I may, about the emergency intervention orders. And then I also want to ask a more general question about health and sport and the relationship between them, if I may. So turning first to the emergency intervention orders regulations. The convener touched on this in his opening question, but I wasn't clear as to what the answer was. Why is this legislation necessary at all, over and above pre-existing common law powers that Scottish ministers already have? What is it precisely that you are able to do under this legislation, which you are not already able to do under pre-existing powers?
Okay, thank you very much, and good morning to you too, Mr. Tompkins. I will say a little here, and then, if I may, Convener, I'm going to ask Claire Meikle from one of my legal colleagues to respond perhaps in a bit more detail to Mr. Tompkins. I think in essence, my answer to that would be that what it allows us to do is to move very quickly indeed. Now, it does remain subject, of course, to a court decision, but it allows ministers in a situation of a pandemic where life and limb is under threat to move very quickly to ensure the protection of residents in a care home. And it is that speed which is the essential part here that would allow us to ensure and to act to ensure, without undue process, to act to ensure that residents were protected, and that where there were threats to life and limb, either because of poor infection prevention and control, cleanliness, behaviours, whatever it might be, subject to proper information, which of course we then have to bring to court as evidence to justify our actions, but it would allow us to act very quickly in order to ensure that those residents are protected. That is different from the situation in normal course, where there is a slightly longer process, but my colleague Claire, I'm sure, will be able to provide more informed detail behind that than I can.
Yep, Claire Meikle, please come in.
Good morning. Yes, the position with the emergency intervention orders is that the nominated officer, or indeed Scottish ministers, where there is an imminent and serious threat to life or health within a care home, is able to enter and occupy the accommodation, direct to control the provision of the care home service, or indeed do anything considered necessary to ensure that the service is provided to an appropriate standard. Those aren't powers which would be available by under common law, and the government position is that emergency intervention orders are necessary to ensure that in extreme situations the serious threat to life is protected within a care home.
Well, okay, thank you. So as I understand it, from the Cabinet Secretary's answer, there isn't anything substantive that ministers are able to do under these orders which they weren't already able to do, but the difference is that they are able under these orders to act more quickly, and that these powers are necessary. We've just been told, even though we've also been told that they've not yet been used, which must query the extent to which they are in fact necessary. So let me move on and ask the Cabinet Secretary about accountability in the event that these powers are exercised. Now, what these powers mean is that, as we've just heard, is that Scottish ministers may intervene directly in the leadership and management of care homes. But care homes are not primarily accountable to Scottish ministers. Care homes are primarily accountable, as I understand it, to health and social care partnerships within the NHS and local authorities. So how will the Cabinet Secretary ensure, in the event that these powers are in the future exercised, that we as parliamentarians, and indeed the public, understand exactly where the lines of accountability will lead? Is it not the case that the exercise of these powers will inevitably blur lines of accountability which are quite now well established?
Thank you for that. No, I don't accept that at all. I think if Scottish ministers acted to use these powers, then Scottish ministers are accountable for their actions to Parliament. And I'm sure, in fact, I'm certain that Parliament would exercise that accountability to understand and to scrutinise the basis on which Scottish ministers had acted, the evidence that they had to act, and the justification for doing so. And nor do I accept that the absence of use of these powers at this point makes them unnecessary. I think that they are there in order to ensure a circumstance where, for example, a care home provider is not willing to undertake the necessary critical improvement actions that the Care Inspectorate requires and that the Care Inspectorate's view in those circumstances is, for example, that residents are at risk, at serious risk, then we really, in those circumstances, need to be able to act to protect those residents. And I think Scottish ministers have an ultimate responsibility to protect the lives of our citizens. And that is at the core what these powers are about. And the accountability of Scottish ministers is, of course, direct to Parliament and subsequently then, of course, to the electorate. So I don't think it blurs the lines of accountability at all. Care homes are accountable to the local partnerships for delivering on the services for which the partnership may have provided them with funds, but they are also accountable to the Care Inspectorate in terms of whether or not they meet the requirements of registration. And we have, as you know, at the moment, an ongoing circumstance where the Care Inspectorate believes that there should be the removal of a registration. So there are a number of areas where care homes are regulated, but in this particular instance, Scottish ministers believe that we require the capacity to act swiftly in order to protect the residents of a care home in those exceptional circumstances.
Okay, thank you. I'm grateful for those answers. Can I just ask a general question? I've got detailed questions about the public health regulations that I want to ask Mike Russell when he is in front of us later this morning. But in your capacity, given that this is the first time that you as Health and Sports Secretary have been in front of us, can I ask you a general question, Cabinet Secretary, about the coherence of the provisions that the government have put into place in terms of easing lockdown restrictions? And can I ask you this specifically, given the portfolio that you represent, how is it coherent to have allowed pubs to open and not gyms?
So the government as a whole reaches the view about the various phases of easing lockdown and whether or not we meet, as you'll know from the process that we set out, whether or not we meet the WHO criteria at each stage, and an assessment is made, but Cabinet as a whole reaches a collective view on all of that. And in all of this, we are attempting consistently to both protect public health, but also to balance the steps necessary in that protection against the other harms that we know that the pandemic has caused. So it causes a direct harm, of course, in terms of the virus. It also causes other health harms in terms of the pausing of some work that would otherwise be undertaken in elective procedures and so on, a recognition increasingly of an increase in low well-being and mental health anxiety that is there in the population. But then there are other harms, of course, that are caused in terms of economic and other harms in terms of education and so on. So the balance needs to be struck across all of those areas. And that is what the government tries to do. And inevitably, in all of those circumstances, there is no perfect solution to any of this. There is a series of clinical advice, scientific advice that we receive, and then judgments that are made by Cabinet as a collective body about what we will do.
Okay, thank you. Thank you, Mr. Tompkins. We'll move on to Shona Robeson, please. And after Shona, it'll be Colin Beattie.
Good morning, everyone. I was going to ask about independent evaluation, but I think the Cabinet Secretary answered that to Stuart Stevenson. So I wonder if I could ask a slightly different question about the support fund. And it's whether there is a mechanism in the administration of the support fund to pick up on any cases of what you might describe as poor employment practice, which may in turn be leading to the reduced or restricted income of staff, and them in turn having to apply to the support fund. Is there a way of picking up on anything like that and indeed addressing it if that is a driver of staff towards a support fund?
Thank you very much. It is a very interesting, I think, important question. As I said, the focus of the work that my officials are doing with the relevant trade unions and the employers concerned is to look consistently at how the fund is being disbursed and used and administered, and trying to resolve any particular glitches as we go. But as we do that, of course, we are collecting data. The survey that the GMB is undertaking will produce, I think, not only information in regard to how care home workers feel about access to the fund through their employer, but also particular situations that those care home workers may find themselves in. So we will benefit from that information. We may, from time to time, identify areas of poor employment practice that Ms. Robeson is referencing, and we will take careful note of that. All of that then feeds in, of course, to the work that we are currently scoping, which will look at adult social care in the round in terms of, as I said earlier, its organisation, its delivery, its funding and its regulation. There is a degree to which, in some areas of fair work and fair work principles, to which, of course, as a government we are committed, there is a limitation on what we can do, given that we don't have powers as a Scottish Parliament over employment law, but there are areas that we can highlight, and I would expect significant improvement in practice. There is also, as part of the fair work, a fair work group looking at social care, and I would expect that they will feed into all of this consideration, none of which needs to take a very long time, but is part of what we're undertaking at this point.
Thank you. That's very helpful. Is it fair to say that if, God forbid, but if we do end up with a second wave of COVID in the future, would the evaluation that is taking place and the data that is being gathered potentially enable any changes to regulations, and having learned from the experience of how this fund is operating, is that something that you would hope to do should we require to have something like this again in the future?
Yes, absolutely. And while, like you, I hope we do not see a second wave of coronavirus cases, you'll know that all our current planning includes preparation to ensure that we have the capacity to respond to that should it arise. And that's not just about the preparedness of the health service retaining, for example, the NHS Louisa Jordan, whilst we use it at the moment for other areas of healthcare. It is also about ensuring that in terms of social care, including care homes, but also care at home, supported housing and other areas, that we have got the right plans in place. And in that includes looking at, should we need to continue, what improvements might we sensibly make to this fund?
Okay, thank you. Sian, is that you? Questions?
That's fine.
Thank you very much. I'll call Colin Beattie next, and after Colin, Alec Rowley.
Thank you, Mayor. Cabinet Secretary, I've just picked up on a couple of issues here from the submissions that have been made in connection with the Social Care Fund. And I'm looking at NHS Ayrshire and Arran, and there seems to be a concern around the eligibility criteria in regard to casual workers. And they are making a case that casual workers should be treated equally in this. Is this an area that's being looked at the moment?
So I'm not sure Mr. Beattie, if Ayrshire and Ireland were referring to agency staff, they may well have been casual work secured through agencies. The difficulty with agency staff is the nature of agency contracts is such that it is very difficult to ensure that we are getting the right evidence through the employer to justify payment of the fund. Although, in line with what I've just said to Ms. Robinson, we remain open to looking at where there may be improvements that need to be made to the fund, and would be happy to consider looking at other areas. But that is the situation at the moment. The eligibility in terms of the fund, which staff are eligible or groups of staff are eligible and which are not, did of course come as a consequence of detailed discussion involving the relevant trade unions, COSLA, and the employers. So it was not an exclusive Scottish Government decision, it was a collective decision reached in order to determine which workers would be covered and which would not. But as I've said, I remain open to reviewing whether or not that needs to be extended at any point.
Obviously, it's a concern if anyone is being left out who should be getting the support they need. Perhaps I can just ask one other question here. Again, taking the submission of the Royal College of Nursing, who have called for the guidance to be amended so that staff who are shielding but have not been placed on furlough are eligible for financial support via the fund. That seems quite an obvious one to be an issue. Again, I'm just going to ask whether you're actually looking actively at that at the moment.
So employers should have access to the job retention scheme in these circumstances, and that was widely accessed by the majority of employers and should be accessed for those staff who are shielding. And that is why at the outset in creating the fund, staff who are shielding were not in the group of eligible employees. Now that the cut-off point has passed for employers to access that, then should we need to continue this fund, then again I am content to look at whether or not it should be extended in those circumstances. But I would need to understand why employers had not accessed the appropriate support to cover their employees and their responsibility to their employees who are shielding.
Again, just taking from the comments here, they say that the Royal College of Nursing says that this small group of staff have fallen down a gap. They're not eligible for support from CJRS or this new fund.
So I've seen the RCN evidence, and my officials, I understand, are having a discussion with RCN on that particular matter. And as I've said, I'm happy to consider whether or not we should make any extension to the eligibility groups of staff for this fund.
Thank you.
Okay, thank you, Colin. I'll go to Alec Rowley, please, and after Alec, it'll be James Dornan.
Thank you, Convener. Just on that point that Colin was making about the RCN, my reading of what they're saying is that where staff were shielding, a number of employers were not keen to put them onto furlough. So it was the decision of the employer, and then there was a cut-off point, the date in June. So if the Cabinet Secretary can give that clear commitment, look at the evidence, have a discussion with RCN, and they are quite clear that what you would need to do is amend the guidance. In terms of when the Cabinet Secretary said, I think in response to Shona Robinson, from time to time we find poor employment practice, and we will tackle it. But the evidence that came in for Unison Scotland, they say poor staffing practices are still widespread in the sector. This means large numbers of staff have no access to proper sick pay protection. But they also go on to say that there is a significant fail-in and many employers are still denying staff the payments which make the difference between them having to risk their own and their clients' health. So do we have an up-to-date position? There certainly seems to be. The evidence that's coming forward in this document for Unison and others is that there are still many care providers, particularly in the private sector, who are continuing just to pay sick pay.
So,
Cabinet, do you have the evidence for that?
I don't have that detail with me. I'm very happy to write to the committee and follow up on that. What I do know is that real-time consideration of problems that are arising does involve the unions, and where any of the unions, or indeed any other party, has evidence of an employer who is continuing to pay only statutory sick pay and not accessing the fund, then we would want to know that and want to then try and understand with the employer what it is that is stopping them, because in essence, this is, if you like, free money to the employer. This is the Scottish Government, the public funds, topping up a situation where an employer's, where the contract of employment only allows for statutory sick pay. So I cannot see why an employer would not want to access that additional financial support in order to ensure that their employee was not financially penalised for following public health guidance and for undertaking the weekly testing of care home workers that we have now in place. And that weekly testing of care home workers goes directly to infection prevention and control. And it's therefore, again, I cannot understand why a care home provider would not wish to ensure that they were cooperating with all possible steps to ensure that infection prevention and control was to the highest standard that was possible. So where we have that information, then we will discuss directly with the employer or through the umbrella body, be that Scottish Care or COSLA or CCPS, exactly what is the problem that we can then try and resolve it so that the individual care worker receives the financial support that they should receive, because that's the point of the fund. The point of the fund is to make sure that they are not financially penalised, and we do not ask employers to provide that additional money. Government is providing that additional money. So that would be my answer to that. Of course, it does go to the heart of some of the arguments. I know Mr. Rowley, I'm sure, would share this. Some of the arguments and the case for exactly that independent review of our adult social care in terms of how it is organised, delivered, funded and regulated, to ensure that we can be more confident about fair work principles being enacted across the whole sector. They are in many areas of it, but self-evidently not in every part of the sector. So that would be that is a bigger question that needs to be addressed in that different way. But in terms of the operation of the fund, where there are those instances, then I would want us to be aware of those and to try as best as we can to resolve them.
Yeah, well, I certainly can't understand for the life of me why that would be the case either, but I think it's really important that the government establish the facts and establish those facts pretty quickly. Because I repeat again, because it's quite stark, Unison Scotland say poor staffing practices are still widespread in the sector. That surely cannot be acceptable. But the Coalition for Care and Support Providers have also made a submission, and I think they suggest that there is not a confidence within employers. They say providers experience today of other funding arrangements put in place during the pandemic, notably the living wage national uplift and provider sustainability funds, suggest that confidence levels amongst providers may be low in this regard. So they're saying from previous experience. But for whatever the reason is, then will the Cabinet Secretary give an assurance to this committee today that work will be done immediately to establish the numbers of the employers that are involved that are refusing to actually participate in this scheme, because ultimately it is the carers and it is the quality care that's suffering as a result of that. So will she give that guarantee? But can also then come to another point that she made in terms of a previous question with Murdo Fraser. She said that where people had been moved out of care homes, that a clinical assessment would have been taken in every case, would have been made in every case, and an assessment of the appropriateness of the care home for the individual would have been made. Now, I'm assuming that any inquiry that is going to take place would be able to access that evidence and look at this evidence. Because only this week, NHS 5 told me that they do not have any records of the numbers of people that were moved from a hospital setting either into a community hospital or into a care home without being tested. They say they just don't have that data. I'm assuming that the data available around the clinical assessment and assessment of appropriateness for people to be moved into care homes, that all that evidence will be available and will be made available to any investigation into the care home tragedy that has taken place.
So in answer to Mr. Rowley's first point, then yes, I can give an assurance that where I am given information of a care home provider who is refusing or choosing not to take part in and access the fund to the detriment of their employees, then we will engage with that employer and try to resolve exactly what the problem is. I would point out that I meet with Unison fortnightly, and no specific information on that has been brought to me by Unison. But as soon as they or anyone else does, then of course I will give the assurance that we would investigate that, consider that, and look to engage directly with the employer in order to resolve that. We supported this amendment. We support the fund. We have set it up within about a month of the Act coming into play, and we are very anxious to ensure that staff are not penalised for following public health guidance and good infection prevention and control, which of course is what this lies at the heart of all of this. What I said in response to the convener was that a clinical assessment should be made both at the hospital end, but also in conjunction with the care home, to ensure that the care home was able and had the capacity to give proper care and support to the individual concerned. So that is an important difference in word, because I am not doing all of these. Of course, I am not in every single hospital engaged in the discharge process of patients. So my point is that that is what should happen, and that is what I expect to happen. It would be part of the patient record of any individual, as you would expect. What will go with them into the care home is a record of all of their healthcare up to date, why they were in hospital, what was the treatment, what is the ongoing management of their condition, if there is ongoing management of their condition, what medication are they on, and so on. And inside that patient record, there should be a note of that being done both at the hospital and that conversation between the hospital and the care home. And of course, if that information is available, then that information, provided it doesn't identify an individual, then that information, of course, should be made available to any inquiry into these matters.
Okay. And finally, convener, and briefly, the evidence that has been submitted through the submissions, to this is there, and hopefully it will be acted upon. But reading through those submissions and other submissions, it actually is really depressing, the state of health and social care, the state of social care and Scotland at this present time. Can I ask the Cabinet Secretary, is she confident that if we have another wave of this virus, is she confident that care homes are now better equipped and more able and have the support in place to ensure that we don't have another tragic situation like we saw with the numbers of deaths from the first spike of this virus? Does she have that confidence?
So since the 19th of March, I think care homes have been receiving and eligible to receive PPE direct from our NHS procurement service. So in terms of PPE supply, and of course that procurement service is now, in terms of its stockpile and its volume of hold, much better placed in terms of previous modelling and the use through the first phase of the pandemic. We are still in that first phase, of course, able to upscale its ordering and its stockpiling ready for any subsequent increase. So in terms of the supply of PPE, the guidance, the staff training that has been undertaken, directly involving from our directors of public health in each health board area and our nurse and medical directors, then I think care workers and care homes have received and continue to receive training in terms of the appropriate use of PPE. The guidance is clear. There is a strong connection across the care home sector now with primary care and through those directors of public health. And in addition, we retain and have taken steps to ensure that we retain that pool of experienced social care returning staff ready to be deployed in order to assist care homes should their staff rota become unstable. There is also the development of what is called the Safety Huddle tool. Now, this is a development from work in the NHS, well-established work in the NHS, applying now in the care home setting, which will allow real-time data to care home providers, but also to the Care Inspectorate and to government and to local partnerships to advise them on the preparedness and readiness of individual care homes at any given point in terms of staffing and resourcing and other supplies. So I think as we have moved through this first phase of the pandemic, learning lessons as we do so and applying those lessons, then we are in a much better place should there be a significant increase in the number of cases. Of course, our surveillance work has also scaled up so that we are moving towards a more predictive approach using NHS 24 call numbers, for example, to give us a clearer indication of where we think spikes in cases may arise. And Test and Protect is well in place now and underway. So there are a number of measures in place and steps that have been taken that I think equip us well should we see a significant increase in the number of cases in care homes or indeed anywhere else in the country, and strong working relationships with all the key partners involved, including the unions and including direct weekly, if not daily, contact with our health and social care partnerships, with the unions, with the providers, and across those with our NHS.
Okay, thank you, Cabinet Secretary. I'll move on to James Dornan, please, and after James, Ross Greer.
Thank you, Convener. Good morning, Cabinet Secretary. Earlier on, we talked about regulations being put in place for Scottish Government interventions in care homes, but could you tell me if the Government are prepared for the possibility of taking over failed care homes?
So that will always remain an option if it is absolutely required, and if no other interventions or steps have been successful in terms of protecting individual residents in those exceptional circumstances of life and limb. So I guess my proper answer to you, Mr. Dornan, is that I have not turned my face against that. So it is there as an absolute backstop.
Thank you for that. But have you had any engagement with the sector? Have you told them to what limits so you're not allowed, you won't allow it to go any further? And if you have had that conversation, what has their response been?
So I have regular conversations with Donald McCaskill from Scottish Care, usually on a fortnightly basis, more frequently depending on the circumstances. But Donald is also actively involved in our Care Home Rapid Action Group and engaged with the clinical and professional practice group as well. So he is well aware of our thinking, but also has a great deal of input into that development. So I've not had a formal conversation with Scottish Care or any other organisation that says as an absolute backstop that is our position, but I would think it is clear that as an absolute backstop that would be our position. The key though is actually to have the sector, and the vast majority of the sector performs and delivers high quality care and does that very effectively. The key is for the sector itself, with our support, to ensure that that is the case across 100% of our care homes, regardless of whether the provider is private sector, independent or public sector provider.
Okay, thank you. Thank you, Captain Secretary.
Thank you, James. I have no more members wishing to ask any further questions. So can I just thank you, Cabinet Secretary, and your officials for your time this morning. And we will now suspend briefly for about 4 or 5 minutes before we move on to the next session. Thank you. If we can reconvene, and can I welcome to the second session of the meeting Michael Russell, Cabinet Secretary for the Constitution, Europe and External Affairs, and he will give evidence on the 4 health protection amendment regulations laid since we last met, which are listed on the agenda. Can I welcome the Cabinet Secretary to the meeting, along with his official, Rebecca White, who is responsible for the health protection coronavirus restrictions regulations coordination. And can I invite the Cabinet Secretary to make a short opening statement?
Thank you, Convener, and thank you for the invitation to give evidence. I want to talk today about the several sets of amending regulations which amend the Health Protection Coronavirus Restrictions Scotland Regulations 2020, more commonly known as the lockdown regulations. On the 9th of July, the Scottish Government published an updated route map which gives an indication of the order in which we will carefully and gradually seek to implement the changes in Phase 3 of the route map. The First Minister announced the outcome of the 5th review of the restrictions and requirements set out in the principal regulations on the 9th of July. The outcome of that review and the assessment of the evidence was that it was appropriate to move to Phase 3 of the route map to easing lockdown. This covered a wide range of different policy areas and necessitated a wide range of amending regulations to be discussed today, give effect to various aspects of Phase 2 and Phase 3 of easing lockdown. And the Scottish Government made amending regulations by way of made affirmative procedure on the 26th of June, on the 2nd, 9th and 14th of July. These amendments entered into force on various different dates, and a plenary vote on amending the regulations is planned for this week. The amending regulations do make a wide range of adjustments to the principal regulation. These are to adjust areas where the decision to implement further aspects of Phase 2 and move to Phase 3 necessitates a change to the restrictions on businesses and individuals. Given the number and detail of the amending regulations, I don't propose to set out all the policy changes in this opening remark. The negotiations have allowed a range of businesses to reopen, including hospitality and retail businesses, have recommenced public worship and various ceremonies, including marriages and funerals, have altered, have increased the number of households a household can meet indoors and outdoors, and relaxed some of the restrictions on gatherings. As set out in the updated route map, there are some proposed changes in phase 3 where we've not set a specific date for when they will come into force. The current expectation is that phase 3 may well last for more than 3 weeks. We will, however, keep that under review. The next review date for the regulations, as people will know, is the 30th of July, this Thursday, and the First Minister will provide an update to Parliament at that time. I hope those brief comments set the scene, and of course, Convener, I'll be happy to answer questions.
Thank you, Cabinet Secretary. And as you say, there are a wide range of issues covered by the various regulations before us, and I know members have a number of different and diverse issues they want to address. I wonder if I can start by asking about the regulations on the introduction of face coverings in shops, which were introduced and made a legal requirement unless individuals have a reasonable excuse not to wear face coverings. This has been now in place, I think, for around 2 weeks. Anecdotally, there would appear to be a high level of compliance with this, but are you able to share with us any information the Scottish Government has about the levels of compliance with the public? And given that the police are able to issue fixed penalty notices to individuals who don't comply, do you have anything you can share with us about the levels of non-compliance and how many notices have been issued?
Well, as far as I'm aware, and again, I would want to provide you with fully accurate information, so I'll make inquiries. But as far as I'm aware, there's only been one case of a notice being issued. I think that is because of the very high level of compliance, which we have seen, I think, in every part of Scotland, and that is absolutely commendable. I think there will be, of course, an assessment of compliance, and there are a variety of ways of doing that. And as that assessment takes place, then I'm sure the committee will be provided with that information. I know that there are people who find this difficult and who have objected to this on a variety of grounds. But I think the increasing usage of this requirement worldwide is an indication of how people also recognise that it is important. But of course, as I think I will say several times during this evidence, I'll be happy to provide you with the information when it comes to hand in terms of what the situation is.
Okay, thank you for that. One thing I've noticed and has been drawn to my attention by constituents is that following the introduction of the compulsory face masks, large shops such as supermarkets, which previously had quite strict rules on social distancing and, for example, one-way systems in the shop or restrictions on numbers entering, seem to have relaxed those as a consequence of the compulsory wearing of face masks. I wonder if you have a view on that, and I wonder if you feel, as I might, that perhaps that's being a little bit too ambitious in terms of relaxing restrictions, and are we putting too much faith in having compulsory face coverings?
There should be no such relaxation. I mean, these are not either ors. The regulations are entirely clear about that. The 2 metre default position remains the 2 metre default position. There are changes to that in terms of retail premises and hospitality premises, providing certain very strict conditions are met. So if there is such slippage, and I have no evidence that there is such slippage, and certainly haven't observed it, but if there is such slippage, then it shouldn't be taking place. And these are for very clear public health reasons. These are not optional issues. These are issues which, and I want to go back to this, and I've used the term quite often in my evidence this committee, which I've given regularly. These are about saving lives at the end of the day, and they're certainly about ensuring public health. So if that is happening, I hope it doesn't happen.
Okay. And finally, before I bring in Stuart Stevenson, who has the next question, while the face coverings are compulsory for people who are shopping, I don't believe they're compulsory for shop workers. Do you think they should be also compulsory for shop workers?
There are obviously other precautions in place for certain shop workers, for example, screens in place that shop workers are behind. Some shop workers are wearing them all the time where they feel it's necessary to do so. That is an issue for the shop and themselves, but of course the default position should be, unless somebody comes, they should be worn. But it will be judged somewhat differently for shop workers, given the fact that there are other precautions in place where those workers are working, what contact they have with the public. But I certainly would expect, in terms of contact with the public, normally, then one would want to make sure, as one also sees in, I understand, in restaurants and bars, staff wearing face coverings.
Okay, thank you. I'll bring in Stuart Stevenson, and after Stuart, it'll be Beatrice Wishart.
Thank you, Convener. In your previous responses to Murdo Fraser, Cabinet Secretary, you used the term very strict conditions in relation to 1 metre distancing. And I think you were talking about pubs and restaurants. Now, another condition that exists is that they record contact details for customers so that in the event that tracing is required, we're able to find the people who may have been contacted. I'm hearing quite a lot of feedback that seems to be working a lot less well than some of the other bits of the system. And I wonder what the government's view is of that. I just give my own single experience of having visited a pub where the only sign was a little sticky label on the tabletop, which in quite small print said, please email my contact details to this particular email address. I nearly missed it, and I had thought I was being particularly careful. So how does the government view how that's actually working, the collection of contact details?
Well, it is something that we wish to see happen. It is very important in terms of the Test and Protect programme. We would want that to happen, and therefore we would want, there's also guidance as to how it should happen, and it's not onerous. In terms of a group of people, it's one of those people that should be the contact person, that an email address and phone is being used, but it is a necessary part of what should take place, and therefore we would want the guidelines to be followed on that, to make sure that it is done in a thorough way, and to make sure that the information is readily available. So there are guidelines. I would encourage all businesses which require to do so to look at those guidelines, and it is a condition of being able to, in certain very limited circumstances, relax the 2 metre rule to 1 metre. Those are very limited, but it is a condition of that. It should be applied.
Well, if I may just come back, clearly this is information that will be used when necessary by the tracing system that we have in place. I wonder if we are yet in a position to have any meaningful understanding from the tracing people about the existence or otherwise of gaps in information that's gathered in places where the 1 metre rule is permitted under the rules that you've just delineated.
Well, as I say again, when the information is to hand about the success or otherwise of a programme, then it should be provided to the committee so that the committee can actually look at that and come to some conclusions about it. But again, I have no indication that this is simply not being used. As far as we are concerned, it is being used. It is being used and should be used as effectively as it is possible to do so. And I stress it is not an optional programme. It is a programme that is absolutely essential for people to observe, because it is a programme that should allow public health concerns to be answered when there is you need to use it for test and protect. It is important to explain to people why this is necessary. Businesses should not only collect this information, they should be able to tell people why this is necessary. They should display notices on their premises or website outlining this. And again, the Scottish Government has provided a template to help with that. It is voluntary, but it is crucial to make sure that it happens. And therefore, we want to make sure that it does happen. It has to happen. We publish a privacy notice setting out how the terms of data should be gathered. Each business will be using the lawful basis of legitimate interest. People have the right to object to have their data erased after a period of time, which, as you know, and I know you know the subject of data control very well, that is where it is. Where an individual isn't willing to provide the data, it's a decision for the business whether or not to make services available to that individual or to refuse entry or a booking. We've been very, we've tried to be as flexible as possible, but it is very, very important that this does happen, because if it does not happen, then it can put lives at risk.
Okay, thank you. We'll move on to Beatrice Wishart, please, and after Beatrice, Adam Tompkins.
Thank you, Convener. Good morning, Cabinet Secretary. Stuart Stevenson's actually asked, and you've given the answers to the questions I was going to ask about the data gathering, and I would also comment that there does appear to be some variation in the information that's being gathered. But I wonder if I could move on to the measures that are being taken by businesses, some of whom are already struggling to make additional investments in protective measures. Does the Cabinet Secretary have any information on what proportion of businesses have been able to adapt their working in line with the new rules? And do you have any, or do you think the rules are sufficiently clear for businesses making these adaptations?
I do think that they are sufficiently clear, but of course there is always help and advice available. You know, as a constituency MSP, as I know, that people will approach us looking for additional information. We can try and find that information. Trade associations have. I was very impressed on the hospitality and tourism side, how the trade associations in the tourism industry have been very, very proactive in making sure that people understand how things should be done. The information certainly that I've heard, and again it is anecdotal because it's very early days, but the information I've heard is that adaptations have been applied, but there isn't an optional issue in this when we come to the issue of going from the default 2 and 2 meters is a default position to 1 meter in certain limited circumstances. That's not optional. There are strict conditions that have to be observed for that, and without doing that, businesses cannot make that change, and that should be stressed.
Thank you for that. Just moving on and touching briefly on the tourism industry, I'm still getting some cases of concern from people with self-catering businesses who are not clear on what would happen if a guest takes ill in their accommodation. So I wonder if there's any further information that can be provided on that. I mean, for example, if a calculation, would there be a cancellation fee, or would the visitor be liable for any extra accommodation? And what happens if they're unable to pay, if they're on holiday? And
those are circumstances that would have to be dealt with individually. I mean, like you, I represent quite a large number of islands, and there are specific issues on islands for people who are on vacation on islands. And if they were taken ill, what would take place? There is a sort of a supplier of last resort in terms of accommodation. The local authority, as I understand it, would have a role if no other arrangements could be made, and that is information that obviously can be given to tourism businesses. But nobody is saying that this is without difficulty, and that is part of the difficulties of moving from where we are. I've been involved in giving quite a lot of information to businesses in my constituency on islands with this added difficulty, including difficulty of people returning home and the fact that they cannot travel by ferry. So there are issues in there. It is up to individual businesses to seek that information. There is guidance online, and the trade associations also have that information, and I'm sure the government will provide more if it is requested.
Thank you. That's the end of my questioning, Convener.
Thank you, Beatrice. I'll bring in Adam Tompkins, and after Adam, Fiona Robson.
Good morning, Cabinet Secretary. Good morning, everyone. I've got 2 sets of questions for the Cabinet Secretary, which I'm asking really on the basis of quite a lot of sustained constituency correspondence from people in Glasgow who are very concerned about aspects of the regulations that we're talking about this morning. The first set of questions relates to places of worship, and the second set of questions relates to gyms. So can I start with places of worship? And a number of churches have written to me in the last 2 weeks, a number of people who would like to worship in those churches. have written to me in the same terms, asking why there has been imposed on all places of worship an automatic capacity of 50, regardless of the size of the place of worship.
Well, that's the maximum number, and that's regarded, as I understand it, number in terms of the distancing that can be undertaken. This is, the faith communities were involved in discussing all this, and certainly it is not an easy thing for any congregation to accept that there is a limitation in numbers, just as there is not an easy thing for any, far from easy thing for anybody suffering a bereavement to accept that there will be reduction in numbers at a funeral or in a happier circumstance at a wedding. But these are regarded as safe figures. Now, the actual decision on those figures comes, and I'm not part of privy to all the scientific discussions, comes in detailed discussion between a range of scientific advisors who come to these conclusions. If Adam, if you want, Mr. Tompkins, more information on that, I'm happy to ask that more information be provided to you in terms of the actual detail of how the figure is arrived at. It is a compromise, of course, I'm sure, but it is regarded as one which is necessary at this stage. We would hope that number would increase as confidence grew that we had the virus under control. But it is a safe and sensible compromise at this stage.
I understand and appreciate that, Mr. Russell, as you know, but we don't have the same approach for retail. With regard to shops, each shop has calculated for its own shape and size the safe number of people that can be permitted into that shop at any one time. And as we all know, we have people standing outside the shops, counting people in and counting people out to make sure that that number is exceeded at no time. So if we can do that for shops, why can't we do that for churches? There are a number of churches in Glasgow where it would be perfectly safe to accommodate more than 50 people at one time, because we have a number of churches in Glasgow that are quite large, where even with social distancing at 2 meters, never mind 1 meter, you could get more than 50 people in safely. So it just seems to me to be arbitrary, whimsical and unfair that we can have bespoke arrangements for shops, but a one-size-fits-all blanket top-down imposed arrangement for places of worship. And when we consider, Mr. Russell, that we talked about this before in the context of marriages, that the right to manifest your religious belief is a human right under the terms of the European Convention on Human Rights, which may be lawfully interfered with only when it is necessary to do so. Why is it that we can't have the same arrangement for places of worship that we already have for retail, and there is no right to shop?
Well, I'm happy to provide you, as I've said, and to ask the scientific advisors to provide you with further information. But I think we should keep a sense of proportion to this. Nobody is saying that people cannot manifest their faith. Nobody is saying that at all. And by saying so, I think you're going considerably beyond what even the most trenchant critics might say. There is a necessary compromise being reached as a result of a highly dangerous situation. And we do know, and we have seen in other places, that religious services and ceremonies of various types have led to an increase of spread of the virus. So there is a proportionate position being taken, and that is being taken after a great deal of thought and study of the situation. Now, we can disagree on it, and I fully accept we disagree on it. But I don't think we should say that we're stopping people manifesting their faith. That is not what is happening.
And finally, on places of worship, before I move to Jim's, why is social distancing maintained at 2 meters for places of worship and not being reduced to 1 meter? What's the reason for that?
Well, because there are very special considerations that are put into place, and I've gone through some of those in the last few minutes about what would require to be done in order to reduce that. But we also know, and the First Minister was very, very clear about this when she reported on the special report she had asked for on this. We also know 2 meters is better than 1 meter. There is no doubt about that. And therefore, to try and keep people as safe as possible, then that is the right level to have it at. And I think this is far from over the process in which we engage. This is and I think absolutely correctly, a slow process of easement of regulations. And of course, they do not go as fast as some people would like. I mean, I receive representations on a whole range of things, in my role as a constituency MSP and as a minister. But it is a slow and gradual easement, and that is the safest way to go at this present moment in time.
Okay, thanks. Let me move to Jim's. And again, as with places of worship, what I'm doing here is expressing to you the views which have been very forcibly expressed to me by the people I seek to represent. Now, how is it a coherent response to a public health emergency which has caused untold damage to people's mental and physical well-being, to allow pubs to reopen, but not to allow gyms to reopen? We all know how important physical exercise is to mental well-being. We all know that not everybody can go for a run in the park. Some people need to use the facilities which are available only in gyms. Gyms are open south of the border, but they are still closed here. How is it coherent to allow pubs to open and not gyms?
Just as what happens in a church is not what happens in a pub, what happens in a gym is not what happens in a pub. You are comparing very different activities in very different places with very different equipment being used. And in those circumstances, the judgment is reached on what appears to be, from what we know, the most risky activity. For example, the use and then reuse of a piece of equipment is likely to be more risky than somebody sitting at a table at a social distance from somebody else. So this is a judgment that is reached on the basis of a very complex jigsaw of activities, where it is not just the activity itself, but other activities within that jigsaw, all of which together will contribute to the issue of the R number, the issue of the increased risk. So it is, I think, wrong to say, well, that's not being done, but this is being done, and we must equate those two activities. They may be different activities, they may be very different activities, but they're also part of a jigsaw. You take one piece out, you might be able to put another piece in. How you do that and how the judgment is reached has been complex, and as I've said, I'm very happy the information is provided to you so you can understand the reasoning. You may disagree with it, your constituents may disagree with it, but it is not done lightly or ill-advisedly.
I mean, I just don't understand this. Why can't studios in gyms be marked out with 2 meter social distancing if you want, 1 meter social distancing if you could go that far, so that we can understand how many people can get into a studio at any one time? We know that gyms have spent significant amounts of their own resource preparing themselves to open under these circumstances. Why can't they do it, and when will they be able to do it in Scotland?
Well, I mean, as for when they will be able to do it, it will be when the announcement is made that they have been included of easing, and that there is a 3-week process underway, and at the appropriate moment that will happen. And I'm sure the First Minister will address these issues, both in terms of what can and what cannot be done. But again, the comparison of one thing to another, two very different things, does not help this discussion. What happens in a gym is very different from what happens in a pub. And in these circumstances, the judgment has been by those who have studied it very carefully that the risk is greater. And in those circumstances, it should not be part of the easing presently permitted. Now, again, there can be a disagreement on that. We can each of us find, and each of us will receive representations about areas where people disagree with it. What I can say to you is it is not entered into lightly. Consideration is given one thing compared to another.
A final question on this, and I think you can hear the frustration in my voice about these answers, because they're really not addressing the core of the question at all. But the final question from me, Mr. Russell, about this is what Scottish Government compensation is being put into place to compensate owners and managers and employees in gyms for the extended lockdown which they are having to endure?
My colleagues who deal with help to business, Fiona Hislop, Kate Forbes in the rural area, Fergus Ewing, keep these matters constantly under review. I have nothing to announce or say today about compensation in any sector, but of course they keep these things under review.
That plainly is not going to be satisfactory to the constituents I'm going to have to feed these answers back to. We don't have Kate Forbes or Fergus Ewing or Fiona Hislop in front of us today. We have you in front of us, Mr. Russell, and I'm asking you a direct question to which I would like a direct answer. You are extending the lockdown for gyms in Scotland beyond the lockdown in England or south of the border, and I want you to tell me, so that I can tell my constituents, what financial package of compensation you are putting into place to compensate people who are losing their livelihoods because of decisions that you and your colleagues are taking.
We are not extending any period of lockdown. We have a set of regulations which we are cautiously and sensibly easing. That is the decisions that we have reached to do so, and we are doing so. In these circumstances, the arbiter, the sine qua non, is not what happens outside Scotland. The arbiter is what decisions are made in Scotland for the benefit of the people of Scotland, to keep them safe and to protect lives and to move on from the virus. Those are really important considerations. I can feel your frustration. I know many sectors are frustrated. But the public good in so doing is what has guided the government and the First Minister and will continue to do so. And I go back to this point. This is not over. And to behave as if it is over does no service to our constituents.
Okay, thank you. We need to move on. I'll bring in Shona Robson, please, and after Shona, Colin Beattie.
Good morning, Cabinet Secretary. You said in your opening remarks that phase 3 may last more than 3 weeks, and we've obviously heard previously the First Minister's comments about the reopening of schools being the focus. Can you say a little bit more about what work is being undertaken by the Scottish Government in making that judgment about whether phase 3 will last for more than 3 weeks? And that's obviously without prejudging what the First Minister will say on Thursday, but what work is being undertaken to balance these issues like the reopening of schools with the potential of the route map going into phase 4?
Well, I think you're absolutely right to stress the reopening of schools as the absolute focus. Now, I'm not going to preempt anything that the First Minister says this week. You wouldn't expect me to do so. But it is absolutely essential that we keep the situation in place where schools are able to reopen from the 11th in the way that John Swinney had outlined in his statement last week. Now, this is always going to have been conditional on reduced infection rates, confidence in surveillance measures, and the process for handling any local outbreaks. And all those things have been worked out very intently on two levels. On the national level in terms, for example, of handling local outbreaks, and on the educational level, and of course I speak as a former Cabinet Secretary for Education, as you know, on the educational level, working through the COVID-19 advisory subgroup on education and children's issues. And it's a very complex thing, because it's not simply about reopening the schools. There's the issue of school transport, there's the issue of the curriculum, there's the issue of things that will be part of it, for example, physical education, introduction of activities such as choir and drama, there's a support for pupils who might have to self-isolate, the teaching in mixed groups. All those things have to be put in place. But that is the priority. And therefore, I would expect that over the next few days and into next week, as we move towards the 11th of August, all the focus will be and should be on making sure that that is an achievable end. Not just an end in itself, that's highly desirable that it happen, but also because it frees up other things. Because it does then free up parents who will be able to return to work. There are lots of benefits that are going to come from getting that right. Of course, primarily and first of all for young people, but then more widely for the economy and for some of the things that Adam Tompkins has been talking about. Easing slowly, gradually, with priorities. And the priority as of, for a long time, and certainly as of today, is to get the schools reopened.
Just to follow up on that, when the government talks about the priority and the focus being on reopening of schools, is that going back to some of the fundamental discussions that we've had in this committee about when you're easing lockdown, you're not going to do all of the things all of the time because that may impact on the R number, and although the R number is low, everything potentially could have an impact. So Is it part of that trade-off that we've talked about so many times before, that the reopening of schools is a big, big step to take, and therefore that may require a delay in some of the other steps that would have otherwise been taken? Is that a reasonable summary?
Absolutely, I would agree with you on it. I mean, we can see it as a very positive sign if you look at the fact that, when we originally published plans on reopening schools, we blended learning model. About that time, there were about 20,000 people in Scotland who could transmit the infection. We're many, many times fewer than that now. So it's a sign of progress. But it is also, of course, a step which is taken, and then we have to assess what the effects of that step have been. And we have to be aware of potential downsides and difficulties which we deal with. This is a very complicated situation. It's an absolute truism. I've said it at this committee. I know the committee has said it itself. It's very hard to come out of lockdown, much easier to go into lockdown. How we come out is really crucial. And the crucial thing is to keep the virus suppressed, to make sure that we are in a position to eliminate the virus and to work on that. And that means that opening schools is something, of course, we would have to assess the impact of it. So we've got a focus on the 11th of August and working up to there, and then beyond there, and the further information on Thursday, I'm sure, from PR, and it's been made clear that will be an important moment. And then we move towards the 11th of August. We move to that reopening, and we move to, in some places, a gradual start over a few days. In other places, a much more sudden start, and we then move on from that. We assess it.
Okay, thank you. Next, to bring in Colin Beattie, and after Colin Beattie will be Alec Rowley.
Thank you, Convener. Cabinet Secretary, I think from the conversations we've been having, it's quite evident that with the phased reopening, there are many members of the public that are a little bit confused as to why their particular passion in sport or whatever isn't being opened up while others are. Looking at the changes to the regulations that are taking place, the sheer scale of them is actually quite difficult to police. So we may put in place requirements in terms of people gathering in public places, people wearing face masks and so on, but we're heavily reliant on the public's good sense in obeying these instructions. We don't have a bobby in every corner. So how are we going to measure the success of these changes as they come in?
There's a huge responsibility on us as public representatives, as elected representatives, to balance the frustration and sometimes in certain groups, and certain individuals who feel very frustrated by certain things. Our duty as leaders to make sure that we are part of the process of safely taking Scotland out of this very, very difficult set of circumstances. So the compliance has been remarkable, and the compliance has been wholehearted. I mean, overwhelming. We all can tell little anecdotes of where we found things that haven't been as good, but by and large, this has been remarkable, comprehensive, and people recognize that it's taking time, and it should take time, and they have confidence in that process. So our job is to try to understand, to listen to people who are frustrated and angry, to try and find out information from them, but step by step, to encourage people to stay with the process, because it's not over. And we've got to put serious messages out there. This isn't over. There's still a lot of work to be done. We're not through this by any manner of means. We can see the information coming from the World Health Organization. We can see the global nature of the pandemic, and we can also see places where progress was made and then progress was lost, perhaps because there was too early an opening. And in all those circumstances, what we've got to do is to take our role very seriously, to articulate for our constituents, but also to articulate what the need and the requirement is, and to make sure that we ourselves are endeavouring to lead by example. All those things are really important. As far as enforcement is concerned, in the end, there are penalties. But, the police have been entirely sensible in making sure that is at the very end of the road. Fixed penalty notices Now, there have been some weekends where there have been quite a number, as we knew in the earlier stages. But by and large, engage, explain, encourage, and only then enforce is exactly the right approach, and we should go on with it.
And we've covered an awful lot of ground already under previous questioning, so I won't delay on that. But there's one little plug I would make is for therapy pools, where they're required for the health and well-being of people. They're obviously not open, and many people are suffering from the lack of these. And I'm pretty sure there could be some sort of social distancing arranged there. So I'll just put that little plug in.
Thank you, and I'm sure it is noted. And at the moment and when it is safe for something to happen, then we will be very keen to make sure it happens.
Thank you, Cabinet Secretary.
Okay, thank you, Colin. Bring in Alec Rowley, please, and after Alec will be James Dornan.
Thank you, Convener. Can I agree with the Cabinet Secretary that we need to be cautious, and it would be crazy after all the sacrifices that has been made to risk that at this stage. But I want to pick up on a couple of points that Professor Tompkins raised. One of those being around public worship. I know from my own experience, I was up in Inverness last weekend and went to Mass at St Mary's, and this weekend I was at St Joseph's in Kelty. And when it comes to the social distancing that's in place and all the measures that was in place, you would say that was the Rolls-Royce model that I experienced. But you then come to the chapel and you go into shops, etc., and it seems like you're in a completely different environment. So there needs to be a consistency in approach. And will the Cabinet Secretary give a commitment that he will continue to look at that discussions will be ongoing with the churches to find out what their experience actually is, because these restrictions mean a lot of people are being denied. You have to book to be able to go to Mass. A lot of people are being denied the opportunity to go to Mass. And as I say, the restrictions, in my opinion, just seem to be the Rolls-Royce model. But that's not what's been practiced elsewhere.
Of course, I'll give a commitment to make sure that my colleagues who deal with the day-to-day issue with faith communities are active on this matter and are continuing to talk with and listen to faith communities about these matters. Of course, there's nothing, if I may use this phrase, about the subject set in stone, about this, but it is the right decision at this present moment. But of course, there should continue to be dialogue, because nobody wants this to last any longer than it has to. I think we should be absolutely clear about that. This is not being done for any other reason than because we believe it is the right thing to do in terms of suppressing, and eliminating the virus. But of course, that dialogue should continue, and I'm happy to make that commitment. And I will ask my officials to make sure that Aileen Campbell, I think, who was involved in this dialogue, continues to do so.
Great, thank you. And I think that's the important point, because you made the point, Cabinet Secretary, that it is about having the compliance of the people. It's having the people on board with that. And I think all credit to the Scottish Government in terms of the way that they have communicated and taken people with them. The UK Government, I'm sure, can learn a lot from that. But people then have to have that confidence and the consistent approach. And the same goes with the gym. For most people, if I spent most nights in the pub, apart from not really feeling well at the end of the week, it wouldn't be as good as going along to the gym. And so people are now asking these questions, and I'm sure you'll agree that it is to ensure that people have confidence that what the government is saying is correct. Now, I think that confidence is there. I'm not faulting that for a second, but likewise, again, I just think likewise with the gym, it's important that we look again. But I mean, other than that, the difference between the approach of the Scottish Government and communication to that of the UK Government has been stark. So this is not a criticism, but it is to say that people are asking these questions. We are getting letters about gyms, and if you can address that, thank you.
I absolutely accept that. I absolutely accept it. And there is no intention to penalise one section or another. and there has to be, and I accept this word from Adam Tompkins, coherence. There has to be consistency, but there also has to be a recognition that this is being done in order to ease our way forward as carefully as we possibly can, in order to not, as you have said, not throw away the astonishing progress that we've tried to make.
Yeah. Okay, thank you, Alex. We'll move on to Ross Greer, please, and after Ross it'll be Graham Simpson.
Thank you, Convener. I'd like to continue the line of questioning from Alex Rowe and Adam Tompkins. I should just briefly refer members to my register of interests. I fulfil a range of roles for the Church of Scotland. I'm not currently a trustee of any congregation. Cabinet Secretary, could you explain why I would be able to go to my church for a service with 49 other people on a Sunday? If I were to go to a funeral on the Monday, there could only be 20 people in the same room.
Well, I mean, I've said I'm happy to get further information on the justification for the recommendation from and provide that to the committee. But I do know that, for example, and Mr. Greer, you know this too, that there is a degree of emotionalism inevitably at funerals, which may lead to a breakdown of some sort in the social distancing. We have actually seen this in regrettable instances. So I think that the limitation, which is has been very, very difficult to accept, is a necessary limitation at this stage, and it is supported but on public health grounds. But I don't diminish the undoubted effect of it, and I'm by no means disagreeing with you that I think it is something that is very difficult to live with. But it is, in the view of those who have recommended these things, necessary.
I appreciate that, and I mean, like colleagues, I'm not trying to disagree with it. What I'm trying to do is to understand why the guidance is what it currently is. Now, it may be that if the government published advice, I would find that I do disagree with it, but I don't at the moment because there's nothing out there. But if what you're doing now is committing to is that you'll be able to supply the committee with that further information, with the advice that led to those decisions being taken, then I'm sure we would be able to take that into consideration. But that's very much what, and I'm sure your inbox is full of the same stuff as ourselves. Members of the public are struggling to understand. We all knew that as the lockdown was eased, the regulations would become more complex and more inconsistent, unavoidably inconsistent in some places. But it's understandable that, particularly in the cases of something like a funeral, someone would struggle to understand why they could only have a fraction of the people who had been in the building the day before for the much more personal, much more important event of a funeral. But if you're able to supply that information then I'd be grateful for that.
I very much note the committee's concern that they require further information on some of the decisions that have been reached and are in existence at the present moment. It is entirely fair that they wish to have that information. I will do my best to see what information we can provide on that, and I will try and provide as much as possible.
Thank you. That's all from me, Convener. If we're getting a further written correspondence, that'd be appreciated.
Okay, thank you. Okay, we'll move now to Graham Simpson.
Yeah, thanks, Convener. I'm not a member of the committee, but I should just say at the outset that I've got no relevant interests to declare. I want to go back to the issue of face coverings. Now, whatever you think about mandating the use of face coverings, it is impinging on people's civil liberty. So I just wonder, Cabinet Secretary, if you could explain why you pushed this law through without any prior parliamentary scrutiny. We're only scrutinising it now after the event.
Well, as a former of the delegated powers committee, you will know that the procedure we are following is an unusual procedure, but it is a procedure that allows scrutiny. This is the scrutiny of it, and it will be, the regulations will be put to the Parliament, as you will know, later this week. That is how we have dealt with the regulations. We have put regulations in place speedily because we feel they've had to be put in place speedily because these are health issues. I have, the last time I was at this committee was the last meeting before the recess, and I made it clear I was available, to discuss these matters, and you're having the opportunity to do so now. So I don't accept the thesis that this is being in some way, done by sleight of hand. This is being done by the process in which we have dealt with all the issues to do with regulation.
I didn't say it was being done by sleight of hand. My question was, why was it done? It wasn't. I didn't use the phrase sleight of hand. Can I ask why in these regulations you were saying that people do not have to wear face coverings in banks and building societies?
I can only assume, and I would have to provide you with an answer, but I can only presume because there will be existing barriers in place. But again, I would want to get more information on the thinking behind the detail of those and provide it to you. I mean, I can see no difficulty in doing so.
You don't know. This is in your name.
Yeah, I recognise my name. I want to provide you with the most accurate answer I possibly can, and I will do so.
Okay, so does this also apply to post offices?
Well, Mr. Simpson, with the greatest respect, I mean, what I'm happy to do is provide you, if you have a look at this, I'm happy to answer those questions. The regulation is such that it will have issues within it which I want to provide you with answers to, and I'm happy to do so.
Right. Okay. Sorry, I'm trying to understand what the regulations mean, and I think that's what you're here to explain. It's in your name. So if you go into a bank, a building society, or anywhere that operates a currency exchange office, you don't have to wear a face covering. Now, so I'm assuming that possibly does include post offices. Would you take the same assumption?
Well, I'm not going to make any assumptions. I always think the best thing to do if I'm trying to be as helpful as I can to a member is to provide a comprehensive answer to any questions you have. If those are questions that you have, I'd be delighted to answer them. If you wish to submit those questions today in writing, I'll get you an answer as quick.
Well, okay. I was hoping you might be able to answer it while you're here, but we'll move on if you can't. I should just point out that when you do come to answer my questions, that in England they have actually said banks, building societies, etc. You do have to wear a face covering. So there is a difference there. I don't know why.
That's helpful information, and I'll make sure that we look at that.
Okay. Can I ask? There seems to be a change of heart or a change of opinion from experts on this. Your own Professor Jason Leach started off by saying in April, the global evidence is masks in the general population don't work. This virus is not airborne. It has to be spread by droplets, hence the social distancing. If this were in the air, then the instructions would be very different, but it's not. So masks in the general population are not helpful. And the World Health Organization have rather flip-flopped on the whole issue as well. Jonathan Van Tam, who you'll know is the Deputy Chief Medical Officer in England, said there is no evidence the general wearing of face masks by the public who are well affects the spread of the disease. So these were quite emphatic statements from experts. What's changed?
Well, the First Minister has actually addressed these issues several times. As the pandemic has gone on, information has changed, the state of scientific knowledge has changed. For example, the WHO, I think 2 weeks ago, was indicating that there was a possibility of airborne transmission, which is a very serious issue. I think there's also a view that there is some evidence, and again, evidence that I think has been published in, if I remember correctly, South Korea, amongst other places, certainly in Japan, I think too, that the wearing of masks appears to reduce the transmission. Now, I don't think there are absolutes on this, but I think the balance of advantage has moved in favour of wearing face masks, as has as has, although there are a small group of people who are very upset by this, as has public opinion. And I think that's shown by the compliance with the regulations, which I think we've observed since wearing a face mask became compulsory. And of course, in quoting the UK, government has followed suit on this and has put in place similar regulations. So I think that's helpful. So, I mean, my own view is that lots of things have developed and changed during the period, and we have all got to be prepared to say that things do change.
Yeah, you mentioned the UK. We're talking about England because the situation in Wales is a lot different, where they haven't introduced the mandatory wearing a face mask. Mark Drayford, your good friend Mark Drayford, seems to take an entirely different position to yourself. He's I wouldn't say he's relaxed. He's not relaxed. He's saying to people, basically, if a place is crowded, it's advisory, wear one. If it's not crowded, use your judgment. Did you never consider taking Mr. Drakeford's stance?
Mark and I, as you say, as you know, are good friends. He's entitled to his view. The view in Scotland, informed by the advice that the First Minister has received, has been different. We are able to do so, we are right to do so, and we have done so.
Okay, I've got just a couple more questions, Convener. To the wearers of face coverings, because people, I mean, I know myself. When you're wearing one, there is a temptation to touch your face, whereas before you weren't doing that. So I can see how there could be a risk.
I think there have been a variety of risks that have been claimed for wearing face mask. One of them was lack of oxygen in the bloodstream. None of them appear to have been well founded, but of course, there may be those who will want to argue that case. I don't think it's a case that many of us would accept.
Well, I wasn't making that particular case. It was merely the fact that people are touching their face. They'll be touching surfaces in shops, and then they go to play about with their face covering. Final question, Convener. What is it going to take? What needs to happen to end the requirement to wear face masks in shops?
Well, I think that is a question that can only be answered when we see the progress that we make with the virus. If, for example, if there was a vaccination, and then the circumstances would change very greatly. So I think it is a question of seeing, as this whole process has been, step by step, how things improve and whether we believe that the balance of risks has changed. All I can say is at the present moment, the regulation is in place and remains in place.
Okay, thank you.
Okay, thank you, Graham. Stuart Stevenson, I think, wants to come back in with a supplementary.
Thank you, Convener. I'm trying very hard not to be really outraged by the line of questioning from my colleague from the DPLR. I speak as someone over 70 and someone who has to regularly measure his lung capacity. It's sitting here next to me on my desk. I go back to the third meeting of this committee when Harry Burns appeared from us. Let me quote from the official report. If neither is wearing a mask and they talk, there is and the person who is negative has a 90% chance of getting COVID. If the person is wearing a mask, the person who's negative only has a 10% chance of becoming positive. This committee has heard evidence from the person who used to be senior medical advisor that the government had, and a man I utterly respect, Professor Sir Harry Burns. But let me just go further than that. The evidence that we've just heard suggested that people who are well don't need to wear face masks because they won't infect others. The trouble is that 50% of the people who are capable of passing on this deadly virus do not know that they carry the virus with them. So I suspect that for the rest of my life, I shall wish to wear a face mask to protect others from the risk that I might infect them. This is standard practice in many countries in the Far East and has been for many years. And let me also nail one other thing that wasn't said, but is implicit in some people's comments, that it's difficult for asthmatics to wear masks. That is utterly wrong, because asthma makes it difficult for you to breathe out. It's a fallacy that non-asthmatics have, that it's difficult to breathe in, and a mask does not inhibit your breathing out at all. And I think the committee should be careful, convener, to return to the evidence of Harry Burns, the huge benefits that there are from wearing masks. And I invite my colleague from DPLR, who's just been asking questions, take away some of my contribution that I've just made and think hard about them. Masks save lives. Masks cost in personal restriction or economic effect. Thank you very much, convener. I realise it wasn't so much a question as a peroration, but I do feel incredibly strongly about this and have good reason to do so.
Okay, thank you, Stuart. We're not here to have a debate about the issues or the merits or otherwise we've heard. We're here to add questions of the Cabinet Secretary, but you've made your point. I don't know if the Cabinet Secretary would like to respond to what's just been said.
I don't, because I think he put it exceptionally well.
Thank you. Well, I'm sure Mr. Simpson is shaking his head, but we're not here to have a debate around these issues. There'll be, I'm sure, ample opportunities when the Parliament reconvenes to discuss and debate different viewpoints. I don't see any more members want to come back in with questions at this point. So can I just thank the Cabinet Secretary for his evidence today. I thank all members for their questions and contributions. We will consider the motions to approve these regulations in the week beginning the 17th of August, once the DPLR committee has considered them. As that was the last item on our agenda, I now close the meeting. Thank you.